I'm going to show you the proper way to fit an Aspen LSO brace in supine position. First, you're going to have the patient bend their knee up and roll to the left side. You're going to take the waist belt, you're going to put it in between here, and you're going to slide it under the patient as far as you can get it. And usually in the bed you can't get it all the way under. The bottom of the brace should always sit right at the top of the crack of their bottom. So you're going to push down on the brace and you're going to have the patient roll on her back, telling them not to pick their hips up, because if they pick their hips up, they'll change the position of the brace, and you don't want that. You'll come around to the other side, have the patient bend this knee up and roll over to the right side. Now, when you're going to pull this through, you never pull on these belts or on this pad, because they'll pop off. So you're going to reach in and you're going to get a hold of the widest part of the brace. And you see there's a little hole right here. It's a spine hole. You reach in there and you feel for that hole, and that helps you pull it around. Then you're going to line it up with the patient's spine. You're going to hold it against their hip, and you're going to have them roll over on their back. Now you're going to bring this around and hook the waist belt. You're going to pull on this side. I always go around. I never reach across to do any pulling on belts. And you always do one belt at a time, and then you pull here. And the reason why you do one belt at a time, because this patient's usually got a lot going on, and if you grab both these belts and you pull them at the same time when they're already telling you that they can't breathe, they'll just freak out over it. And so I do one at a time and I ease them into the brace. Once I get them into the brace, 9 out of 10 times they're thankful, because it's helping. To take the brace off, you unhook the belts and you put them back where you pulled them from on each side. Then you go over and you unhook, slide this back in, have the patient bend their knee up, roll over to their side, and just reach in and pull the widest part of it out. Now you've taken the brace off. Now, after you take the brace off, you'll see these strings are hanging from where you cinched it in. You have to reach in and pull every single time you take it off to retract the strings in. If you don't, these will end up wrapping all the way around the patient and there'll be no tension and no support. So every time you take it off, make sure you take these side belts from here back to where you got them, and then reach in and retract your strings every single time. Remember, whenever you're rolling the patient and sliding this underneath them, always tuck the waist belt in here so that it's short and easier to get under the patient. And also remember that once you get it under them and they roll to the other side and you're bringing it under to line it up with their spine, you always reach in for the spine hole and get a hold of it and pull it. That makes it easier. That way you're not pulling on any other belts on the brace. You pop nothing off, everything stays intact, and you can pull it around and then line it up with the spine. Once you determine what size your patient needs, like I said, when you take these out of the cabinet, they're all set on medium. When I say medium, you have to pull this belt up, and that shows you your sizing. On this side, it's large, extra large, double extra large, and when you pull this back, it's medium, small, and extra small. So if your patient is a large, you would have to get a hold of this and pop it out. You'd bring it through that slot, you'd flip the belt over, and then you would click it on the large side. It's kind of confusing at first, but after a while it gets easy. Let's say they were a large and they lost weight and you had to put it on a medium. You would unhook this, flip the belt over, slide it through the slot, and then hook it on the medium on the underside. And it'll catch and go into the slot, and then flip the belt back over. And then bring your cinch belt over and retract it in. With the Aspen Vista LSO, there's not much care to it actually. We tell patients that they can shower with this brace on if they shower at night before they go to bed, because this brace is foam, mesh, and plastic, and it will dry overnight. So they need to just hang it over their shower rod and let it drip dry, or put a towel on the dryer and just open it up and lay it on the towel and turn the dryer on, because the dryer top also gets warm and it will dry overnight. Just when you get out of the shower, make sure you rinse really good. But that's the easiest way to keep it clean, and you don't have to take any of it apart. Pretty simple.